Hi, I'm Monica Dudley-Weldon, and I'm president of Monica Weldon Consulting. I'm also serving at the pleasure of Governor Glenn Youngkin. He appointed me to the Commonwealth Health Research Board in the state of Virginia. Well, I first and foremost am the mother of a son who has an ultra-rare disease called SYNGAP1, and he was the 6th patient in the world diagnosed with this condition. And I had started the first research organization in the world to drive treatments for it. I've since sunset that organization and I've gone on to a broader spectrum of working in the rare disease community by working in national defense in the federal government and then also at the state level. And so it's really opened doors to seeing how far-reaching rare disease is across the geopolitical divide in our country. So. Oh, I think I started 10 years ago, and our landscape has changed so much over the last decade. I think I've been in the rare disease space almost 13 years before I'd started the organization. And technology and policy has moved rapidly. It has been a game changer for genetic testing, being able to identify many more people, especially around newborn screening expansion. We have so much more to do, but we have really come really far in the last decade since the human genome has been identified with all these different diseases, and it's just been incredible. Oh, the challenges in supporting rare disease. When I was a leader of an organization, I think we had close to 80 different countries, and the challenges are enormous. We have mountains to climb when it comes to policy, when it comes to innovation and technology and reaching these patients. You've got different geopolitical environments that such as in China, even preventing the communication to patients and getting the word out. Access to drugs, certain drugs we have access to here in the United States, we can't get access overseas. The disparities are enormous, and the challenges are coming together with solutions slowly, but we still have so much more to do in the area of reaching a global community for these rare diseases. I am looking forward to being able to present some new insights that I've learned working in the Department of Defense, or the Department of War now, being able to work in national security and how supply chain and manufacturing affects rare diseases, on top of even just repurposing drugs and getting access to those precursor molecules, APIs, all these critical minerals that are needed to make medicines. And so I'm excited to give a bird's eye view on a global picture of how that environment also affects rare diseases and makes it so much more complicated, and looking at those different types of solutions to close those gaps. I'm excited. I was one of the first board members for Indo US Rare when they started out, and it's an honor to come back and be a part of this conference and be included in these collaborations, because I'm learning just as much as people learn from the other speakers, how we can all work together. And collaboration, I believe, is 100% the way we can close all of these gaps and all of this, the disparities that we face. And without understanding where each one of us are coming from, we're not going to get there. And so I think being able to bring that expertise here and really communicating these messages and listening to learn is very important.